Okay, so could you tell us a bit about the Ambition trial of GSK?
Sure. So Ambition trial was an event-driven trial, and there were quite a number of patients recruited, over 600 patients, which for a rare disease such as PAH is quite important. And it was performed alongside 7 years, I think. It was finalized last year. It was published in New England Journal of Medicine last August, and it has been already included in the labels for the products that were involved as well. But I think beyond that, it is a landmark study in itself, because not only because of the big number of patients, but because it had an innovative kind of endpoint. It looked at the things that the physicians want for the patients in real life. I mean, I do not want a patient not to get worse. I want the patient to get better. I mean, that's the whole purpose of treating somebody, right? And this was the first study in this indication that looked at improvement and considered the lack of improvement as a failure. Then it was also a landmark study because it looked at the treatment strategy, right? And similar to other pathologies in the past, it marked an evolution. So initially in oncology, diabetes, cardiac failure even, diabetes, the treatment was started with a one drug, monotherapy, right? But then the patients did not really do better in time. So people thought about hitting hard and earlier disease, which meant combining 2, 3, depending on the disease, drugs from the beginning, from the diagnosis, and trying to achieve better outcomes for their patients. And this was what Ambition looked at. So you have a patient newly diagnosed with this horrible disease, which is PAH, and would it make an impact on the patients if they were treated from the beginning with 2 drugs, addressing 2 different pathways involved in the pathology of the disease? And the answer was yes. So it was a difference. It was a massive improvement, 50% reduction in time to clinical failure, which is really big and important. Therefore, I think this achievement or this new treatment strategy was recognized as being an advancement by being included in the guidelines. As you may know, the ERS and ESC published new guidelines in August last year, and upfront combination therapy, or the initial combination therapy with 2 agents, 2 representatives of 2 different classes of drugs, is there recommended with a level of evidence of 1B, which is not too bad, I think. So that is all of it is generated by the community of physicians that are treating patients with PAH. And it was their idea, and it was the companies that, hold hand and invested and managed to bring this proof for the benefit of the patients, ultimately.